Hi there, folks. This is Dr. Ellenburg. Welcome to our medical show here on News Talk 1020 AM, 95.5 FM. You can find us online, of course, at foxnewskoan.com. That's foxnewskoan.com. And you can live stream us no matter where you're at. And, of course, we sound really good on FM 95.5 as well. So reminders of how you find me during the week. You'll find me at the Ellenburg Center for Natural Medicine. Our phone number there is 563-2366. We have a website online as well, and it's drellenburg.com, and that's DR, short for doctor, and then Ellenburg, ELLENBURG, so drellenburg.com or .net. Check us out. List of our services. Some suggested websites for you to visit and learn more about the environment and your health. And a few books you might want to consider reading more about, like things like vitamin C and hydrogen peroxide therapies. And then beyond that, we're checking it out. So again, that's drellenburg.com. I do see patients in Kenai and Palmer. For times and dates, call our office at 563-2366. All right. I just came back from a 4-day conference down in Dallas, Texas. With it's a group. It's got a real long name called the International Organization of Integrative Cancer Physicians is the name of the group. And they've been around for quite some time. They changed their name here about 2 years ago. But they're a group dedicated to looking at the use of integrative therapies in the world of oncology. And so in oncology, I'm not an oncologist, I'm a naturopathic doctor, but in oncology, what is used to treat cancer is typically going to be one of three things, or two or three things, or all of those. And those are either radiation, chemotherapy, or surgery. Those are the main things being used. And in integrative oncology, what that is looking at therapies that can be more times than not adjunctive, meaning they're supportive. We do things in our clinic to help support patients' immune systems. I mean, IV vitamin C can be used to help out patients. It can also be used to help even treat cancer, and it's being used in quite a few studies in the last few years that are being researched to see what the use of high-dose vitamin C can be in treating cancer. Also in integrative oncology, you can use different vitamins, different supplements, or different herbs or minerals. One, to help support the patient's immune system, also decrease side effects of the current therapies the patient may be receiving from their oncologist. A lot of ways of doing this, so integrative neat piece. And what we're going to go into over the next few weeks are some of the different lectures that were talked about. And in particular, next week we'll get more into, because I had plenty for this week already. And I have a few cancer things to bring up today as it is for our lineup of things. But we can talk about food in its relations to how can we prevent cancer versus getting it. And that's a very good thing to have around, and some reminders of categories of things to be eating in our diets all the time. So we'll go on into that. Actually, maybe in the second half of the show today as well. But at this point in time, we will go down the road here and talk about diabetes, a very interesting article that I actually found from doing some of my email clean out on the ride back in the plane last night. And this one was a very interesting one that came out of, where did it come out of? So it's diabetes and the overweight should get up and walk around every 20 minutes. A new study, as it was called. And where did that appear? I did not write that down, did I? Well, that's unfortunate. But nonetheless, it was a study looking at more of an observational study, trying to figure out intervention studies looking at changing someone's health based on their activity. And they looked at the effects of having patients take glucose, some type of a drink, and levels of insulin. And after that, those when they took the drink, is following them for the rest of the day and giving them times where they were uninterrupted sitting still. They had sitting, but interrupted by brief bouts of light or moderate intensity walking. So basically, a person's there at their desk for 8 hours a day, 7 hours a day, how you want to put it, or they're sitting there and at different times of the day getting up and doing certain amounts of light or moderate intensity walking. And for those who work in buildings or stairs in the back stairwell, there's a great example of that. Take a break, go up and down the stairs a couple of times. Or if it's a real tall building, go up about 5. Good exercise, right? In this study, they looked at the ages were about 45 to 65. And again, we had folks who just sat still. They had people who were seated, but they had 2-minute bouts of light intensity walking every 20 minutes. And the third group was seated with 2-minute bouts of moderate intensity walking every 20 minutes. So they did quite a bit more. And they'll drink a certain drink to help look at their glucose and then how insulin was involved. And they're measured. And what they find out, basically, what they found out is that the people who actually had interrupted sitting had better overall levels of glucose, better insulin sensitivity, and specifically in the one group who had more moderate or more intense walking for 2-minute bouts, had much better parameters. And it's just a reminder again, and for a lot of us that may work, I mean, in my own office, I mean, I work in an office setting, but I'm also up and down quite a bit today. That is back and forth between treatment room and my office and those sort of things. Or if you're in an office working at a desk all day long, it'd be important to consider even taking twice a day, even for 5 minutes. Walking outside would be even better, but if you can't do that for a reason or a certain time of the year, unlike right now, of course, you could be walking up the stairs in your office building and getting some light exercise. So again, it's a reminder that exercise is a phenomenal thing for helping treat diabetes, for that matter, type 1 and type 2, and also for actually helping patients maintain healthy glucose/blood sugar levels through exercise. Once again, here we are, exercise. And of course, all that always includes is a good diet. But so I don't have the listing where that came from, but it was a nice little article just showing some basic things and how that can actually affect your overall glucose sensitivity in your body. Now let's move on to cancer here a little bit. And we're going to discuss a couple of different dietary things. And I actually found what I wanted to on this. Dr. Silberstein, Susan Silberstein, is a PhD researcher out of the Philadelphia area here in the U.S. and put on a very interesting lecture looking at food. And the one thing is about diet and cancer risk. And so there are over, and she has listed here, there are over 4,500 studies. Fresh fruits and vegetables can prevent cancer. Another study. People who eat the most fruits and vegetables had a 50% lower occurrence of cancer. So we can literally, change your diet and change your risk. Another study looked at, this is a wild one, it was the European Prospective Investigation into Cancer, also known as the EPIC study, that increasing fruits and vegetables by 150 grams a day, which is basically just eating one small apple, they found that they were extrapolating the data out that you could prevent 36 new cancer cases a year in the U.S. from happening just by eating one small apple a day. To give you a general idea of what kind of antioxidants and vitamins and minerals are in that, something like an apple, for example. So a very simple thing to demonstrate this. We do know along with diet that for a fact that obesity can be involved in increasing risk of cancer, and then definitely if you are overweight, it's the one thing you want to get working on sooner than later because your chances of developing cancer are much higher with certain types. For example, people who are overweight, highest risk was an endometrium in females, so for ovarian cancer, uterine cancer. Another group was esophageal cancer, your esophagus, and pancreas is about a 30% chance of increase of if you are obese for a long period of time, increasing your cancer risk. So again, how we change this? We change it based on diet. And this one was a great one here. So this is the National Cancer Institute. And this article says, looking for motivation? It says, we don't mean to scare you, but eating well is a low priority item on your agenda. Take a look at these stats. And these are basically estimates of cancer deaths that are avoidable by dietary changes. So by changing your diet, you decrease, it increases your percentage of not getting this type of cancer. And the highest in the list was prostate, colon, or rectal cancer. And that was at 75%. Now, these are estimates of cancer deaths avoidable by changing your diet. So 75% of all prostate cancer deaths could be avoidable by changing the diet. That's what they're saying in the National Cancer Institute. 75% of deaths due to colon cancer or rectal cancer could be affected by just changing one's diet. Same pancreas here next. The bottom of the list overall was throat cancer was about 20%, but these are big numbers. What kind of percent do you want to have? I'd say anything over 10 is like, yeah, I should be doing that, right, to prevent your chances of ever getting cancer. So again, extremely important in looking at what type of nutrition we're actually getting. All right, so let's take a break from that and swap back over to my article for today that I found, looking at how high-fat diets can increase colon cancer risk. And this one's pretty interesting because it gets into some really detailed stuff, looking at the actual inside the intestinal wall of patients who had colon cancer or those who did not have colon cancer, and looking at the tissue themselves. And this study appeared in the Journal of Cancer Prevention Research, and looking at, again, a high-fat diet, and they looked at the tissue themselves. And it says here, in normal tissue from patients who have colon cancer, they found genetic marks, or in this case, epigenetic marks, this is part of your genes, that were involved in breaking down carbohydrates, fats, and proteins. And, of course, high carb, high protein, high fat are, of course, a very commonly thing with our standard American diet, or SAD, or SAD for short. And they found that in people who did not have colon cancer, there was definitely a different pattern of their genetics making up their GI tract. So alone, just based on food, you can see changes that direction. And you have pathways in people who have not just colon cancer, but this is the article itself, colon cancer, but pathways in cancer patients that, your glucose, the way your body is using sugar and insulin are running completely different in those who don't have cancer. Okay? Your membranes themselves, right, the cells have become corrupted, and particularly the ones that are cancerous. They're not following the rules anymore. They're using sugar as their main fuel source. They're using some proteins in that process. And in one area that came out frequently down at the conference, I was very happy to see, was a discussion of what type of diet, and you've heard this before here on the show, but I want to reiterate it because it's a great thing we're talking about. What type of diet should somebody who has cancer be doing? And there is a great book that's thick, so for those who are science-minded, you could read about. It's called Cancer as a Metabolic Disease by Dr. Thomas Seyfried. And in this book, he pretty much spends a majority of the time until near the end of the book trying to prove the fact that a very famous scientist in the past, known as Otto von Warburg, was right, that cancer is a metabolic disease. That does affect oxygen utilization at the cell level. That does affect how glucose is used, and it really changes the way cells are going to create and burn energy, in this case tumors. So what happens in tumors is that their means of creating energy becomes corrupted. Now, the $10 trillion question is, why is that, and how does that exactly happen? That's what's trying to be figured out in many ways. But cancer is a disease of many different possibilities, or another word you can use is multifactorial, has many different causes. But specifically on what a patient should be eating makes a lot more sense in almost any type of cancer. Because we want to take away the fuel sources, yes, fuel sources, not just one source, fuel sources that tumors are going to use to continue to grow. Okay? One of the main ones, of course, is being sugar. Tumor cells end up using glucose, and they basically ferment to create energy out of that. They can also use small amounts of protein to help run that process. And one of the newer approaches, because in the past I've said for years, well, low sugar diet, low sugar diet, low sugar diet. Get on a low sugar diet if you have cancer. Okay, well, it goes beyond that, because if you have a diet that's low in sugar, but you eat a whole lot of carbohydrates that aren't vegetables, by the way, things like carbohydrates are vegetables, but you're eating carbs that are from different sources, such as pastas and breads and pastries and these sort of things that are these refined carbohydrates that really aren't doing a whole lot for you. They eventually, your body can convert it into sugar and can be used as a fuel source for tumors that may be in you if you have cancer. So you want to be able to change that food source. So not only eliminating sugar in your diet, but also eliminating refined carbohydrates, things like, of course, like white bread and white rice, and I said pastas, and those sort of things that burn very quickly in the body. And the other piece that's the newer end of this is talking about actually eating a diet that is low in protein. Now, and this run counters to a lot of diets that are suggested, I think, by oncologists. And why is it going to run counter that? Well, because we're looking at the actual metabolism of the tumors. What are they eating? And if you're eating a fairly high protein diet, you're going to be providing the substrates, the ingredients, so to speak, that are needed to help that tumor cell also use glucose at a very high level. So we're recommending to patients, or I'm recommending to patients these days, if they can do that, as far as the cancer type of a diet is, the fat can be good fats, not so it's a high-fat diet, but good fats, such as, what's good fats? Flaxseed oil, flax meal, for example. There's debate using that in breast cancer patients, but overall it's a good choice. Avocados are high in fat. Healthy, fatty foods, and they actually exist. A lot of them basically talking about, in this case, vegetables. Low protein, so maybe some fish, depending on where it comes from, of course, and what the question. Pretty much no red meat, and lots of vegetables. And many of you are like, oh man, I don't know if I can do that. Well, if you have cancer, you're motivated to make changes. You should be, at least, because the food is a huge piece and really needs to be looked at. So it's a very simple overview of a very complex topic in talking about what to eat when you have cancer. But the reality is low sugar, for the most part low protein, mild to moderate carbohydrate intake, and moderate fat intake. Okay, you can follow that. You're going to take away you're taking away fuel sources for the tumor to grow. That makes a lot of sense to me, and the science behind it makes a lot of sense as well. So, all right, folks, you're listening today. This is Dr. Michael Ellenburg. It's our medical show here on News Talk 1020 AM. Also find us online at foxnewsKOAN.com, and of course, you also find us on the FM at 95.5. If you got questions about your health, we do encourage your phone calls here, of course. It's 522-1020. It's 522-1020. And I get no problem changing the topic to something else in medicine. It's fine. But if you have questions in this direction, give us a call here, 522-1020. Okay, well, let's hop along here. And what else we got for you today? There's an herb that I have used off and on over the years for treating, a lot of colds, even viral problems. Olive leaf or olive leaf extract has been around for some time. I even wrote a little monograph, which is basically a summary of botanical medicine actions of this when I was in naturopathic medical school as well. So I've always liked olive leaf for a very long time. And I've used it off and on for the years to either prevent colds in myself or help patients get treated with it to help improve their immune system. And so definitely olive leaf extract can be a great thing to be using to boost immune system function while you are sick from something or to avoid getting sick. We also know in treating high blood pressure, although I don't typically use it for that. But a recent article that appeared ahead of print entitled, what's the journal here again? Hiding these things today on us. Entitled Leaf Polyphenols Improve Sensitivity in Middle-Aged Overweight Men. And actually here there's a PLOS one, so it's an online journal. But polyphenols in this case are part of the olive leaf, so it's the leaves of the olives being used as far as treatment here. And in this study, they had a crossover trial, so back and forth here between different groups. But the mean age of the study was about 46. The index was about 28. And they had the men in the study supplement with olive leaf extract for a period of 3 months. And what they found is that there was found to be almost a 20% improvement in those patients' means of having insulin sense their sugar in their body properly. Now, insulin's secreted from your pancreas, and when you have digestion take place and sugar then comes into the bloodstream, we want to store that glucose and put it away. And the liver, the fat, and the muscles are the main areas, and that's where insulin gets involved in this. And one of the things that we worry about frequently is that we have massive rates of type 2 diabetes happening in this country. And the means of trying to go about changing that, at least in the sense when a patient actually already has type 2 diabetes, is improving their insulin levels, improving their insulin sensitivity, how the cells sense that insulin, and then take that message and then store the glucose in the liver, the fat, and muscle cells. They also found there was almost a 30% improvement in certain aspects of the beta cells, which are involved in secreting insulin in the pancreas themselves. And they also found some improvements in some inflammatory markers as well. So overall, there's a number of things herbal-wise I've talked about with the use of preventing diabetes or enhancing insulin sensitivity in patients. Things like cinnamon over the years. There's different minerals like chromium and vanadium. And now we have another one added to the list again is the use of olive leaf extract. There's also another herb called Gymnema sylvestre, another very good herb too. So, and berberine, another good herb. So a lot of different things that could be used for treating this. But again, whenever we're suggesting, even consider reading about these things online, or you may want to take it someday. I mean, if you have type 2 diabetes, you're not focused on your diet and exercise, this information will be useless. It will be useless. It won't be as effective or nearly as effective. We need to have that good diet on board. We need to have exercise taking place, several times a week to get some real differences in changing that. So, again, this one was on olive leaf extract and appeared on the online journal of PLOS this month. So, check it out. We've got a couple of minutes before the bottom of the hour break. If you were to call, it'll be a short question, but our number here again is 522-1020, 522-1020. We'll wait for that. Let's delve in a bit more here that's important. And, every year, or the last 2 years at the cancer conference, there has been typically 1, 2, or even 3 lectures talking about stress. And it really is a big deal, or even emotional stress. So, what's the word to use there? Things in your life you haven't dealt with. And one thing I like to tell most of my cancer patients when I see them, and it's kind of the end of our consult, is if there's things in your life, family members, friends, whoever it may be, that you have problems with, or there's been conflict, or there's been stress, or emotional things, or trauma in your life, this is the time to address it, because you would be amazed at the ability for how your mind can really heal you. One doctor is Dr. Cowden from, he lives in Panama now, I think, but he had a story because he had to mention it. His daughter was going to school here in the U.S. in college, and her friend who's 19 years old, was diagnosed with breast cancer at age 19. And they wanted her to do chemotherapy, they wanted her to have surgery, maybe even radiation. And she basically said, I'm not going to do any of that stuff. I'm going to just focus on school. I'm going to enjoy my life. And let's just skip. I don't think she did a whole lot of things. Like, she didn't go out and do a lot of detoxing or change her diet massively. She just changed her state of mind, it sounds like. And a year later, without any intervention, her cancer was gone. Now, how can that happen? I don't know how that can happen, to be honest with you, but nice if it happened a lot that way. But sometimes the biggest stumbling block is our brain, is our mind, on getting ourselves healthy, even regardless of cancer. It can be different other health conditions that are being affected by how the stress in our life is, or if we're unhappy with our partners, or they just got divorced and it wasn't a good. All these these emotional things are really a big deal. And Tom, we got you on line one. We got about a minute, but what's going on?
I know. I just wanted to let you know that I was listening, Mike, and I wanted to remind your listeners and you, there's a book called The Survivors Club by Ben Sherwood. He used to write for the L.A. Times.
Nice.
And he focuses on an analysis of how people survive, and it's from positive thinking. It's from all sorts of things. He goes over everything from an injury to cancer to losing a child to being in a prison camp in Nazi Germany to a plane wreck. Starts off with a boating accident, but you should look into it, and people should, because I think you're spot on what you've been talking about attitude, which is an integral component of his book.
Absolutely. You said?
Yeah, The Survivor's Guide.
Okay. Excellent. And what's his last name?
Pardon me. Did I just say Survivor's Guide? Survival Club.
Survival Club.
The Survival
okay.
Club.
Survival Club.
Yep.
All right. Great.
Thank you, sir. Keep up the good work.
Thanks, Tom. Thanks for listening. Bye. Yeah, so a lot of good books out there in looking in this direction. So Survivors Club, and definitely don't forget the mental, emotional piece of any type of chronic disease, including cancer. All right, we'll be back here in a few minutes. Hang in there, folks.
I need to laugh.
Hello there, this is Dr. Ellenburg. Welcome back to our medical show here on News Talk 1020 AM. We're also on FM 95.5. You'll find us online. You can live stream us at foxnewskon.com. That's foxnewskon.com. If you have questions today about your health, the number here is 522-1020, 522-1020. All right, well, once again, Tom for calling. Again, he mentioned a book called The Survivor's Club. And one may think, well, that's a book in case I beat cancer. No, it's a book using even if you have cancer, or better yet, if you want to get cancer, right? Changing the way you think is such a really important factor for many things in our life. And you'd be amazed. One of the main reasons I got involved into the type of medicine I actually did was from books by Deepak Chopra, like in 1989, 90, and books by Dr. Larry Latouche. These are some of the forerunners of looking at mind-body medicine, medical doctors, folks. And they really opened my mind into considering what type of effect and how we think and how that will change, how it can affect our lives and our health, for sure. So those are good books as well to consider. And even Bernie Siegel, who was a great, he's still alive and well. AMD wrote a book called Love, Cancer, and Miracles, I think was the book. And that was written like in 91. And it's still a good book today. I mean, getting patients to visualize, for them, when they were getting chemotherapy, for example, you'd have them write up, do drawings the best they could. I'm a bad artist myself, but, what do you see the chemotherapy doing? And someone had this idea like, James and the giant peach, where, the peach is the tumor and the chemo are the sharks, and the sharks are eating away at that peach, and to have them visualize and do those things when they're getting chemotherapy to actually try and enhance their treatments. We can use in any particular incidents, but that's just one way to describe this stuff, to consider the use of the mind into the use of your own medicine. Okay, well, let's move forward from here. And speaking of the mind, let's talk today about memory. And we're going to talk about Alzheimer's and a few different things, and also different types of brain diseases such as Parkinson's, for example. These diseases of the brain that are degenerative. They break the brain down over a period of time. The longer word is neurodegenerative brain diseases. That's a mouthful, isn't it? But the first one is looking at a study out of New Zealand. And again, they didn't give me the, here it is, the American Journal of Clinical Nutrition. And the new study is looking at brain function could be improved with as little as 1,200 milligrams a day of DHA. Now, DHA is a fatty acid, an omega-3 fatty acid. Its longer name is docosahexaenoic acid, but DHA is much easier to say. DHA is found very high in our brains. It's supposed to be found high in our brains. Maybe in those that it's not, it's why they might have problems. We don't know that for sure. But there's also EPA in your brain as well, omega-3 fatty acid. And from fish oil, you can get DHA and EPA. You can also get it from krill oil. And there's even a few different organic sources out there. Vegetarian sources that can supply certain amounts of DHA. In this study, they looked at both men and women, and the result was that women get smarter and men get faster after using fish oil supplementation. So this is a new study. And what was done is they looked at a group of men and women between the ages of 18 and 45, and through diet and history and questionnaire, figured out that they were fairly deficient in DHA. And therefore they were prescribed to take 1,200 milligrams per day for 6 months of DHA. And they would test their abilities via a computer program. And in women, they had greater improvements in memory involving episodes than men, while men increased their reaction time to a greater degree than women. And what's great about this is the study involved improvement in both memory and reaction time, also known as RT. So you're getting two enhanced benefits. Also, by the way, DHA is a great anti-inflammatory, and many diseases of aging that include the brain can be involved, having inflammation taking place in your body. And you can be taking something to decrease your inflammation, the better. So certainly in this case, fish oil be that, and specifically one that would be more weighted in the amount of DHA it has in it versus EPA. And you can look on the back of the bottle when you get that. And, one thing to remember about supplementation, too, is it's not about buying. People are funny sometimes. They'll be, well, what are you taking? And they'll be taking a variety of things, and a lot of times it'll be something like from a big package store. And I say, why do you get those there? Well, they're cheap. They're inexpensive. And one of my attitudes about that is not to say that you can't buy certain vitamins at a lower cost and still be effective. You can buy some, but a lot of times it's how they're put together. But would you want to buy cheap food, right, to feed your nutrition if you're trying to enhance your body's means of doing things? No, you want to buy good food. So buy good vitamins. And there are many companies out there. Don't require you have to go see a provider like myself to get them from me. But companies like Nature's Way and People's and Solgar and Twin Labs, companies have been on the market for a very long time and can make some very good products versus taking things like Centrum, for example. And there's only so much you can cram in one pill for a multivitamin once a day. One pill. Usually you need to take something that's a couple of pills a day to get that. And this is assuming you're eating a good diet and exercising, right? Key facts: diet, exercise, then a multivitamin mineral on top of that for some extra support and backup. All right? So that was the one talking about fish oil and memory. And then there's an article that came out here just recently in the Journal of Nutrition that the researcher and a few other ones basically said, okay, here's what we're going to do. We're going to review all the data we can find that concerns the use of vitamin D being measured in people with Alzheimer's or Parkinson's. And it's called a meta-analysis. So they gather a whole bunch of data, and they start mining through that data to figure out what type of results were going on. And what it turns out is that it seems that people who have lower vitamin D had increased risks. And the concern is that definitely with Alzheimer's, and I know Parkinson's itself is on the uptick, these things are happening more often in our society. And one argument is, well, we're living longer, and that's why we're seeing more of it. Well, I think it's more than just that. I mean, the biggest changes in how long we're actually living is the fact that our infant mortality rate actually goes down, or has gone down. What does that mean? Well, it's the same thing of I always use the example of trying to take 1 and add it to 76. You've got say you have a 1-year-old who unfortunately dies at age 1 due to some disease, and then you have somebody who dies at 76. Well, what's the average of their age? 1 plus 76 is 77, right? Okay. Divide it in half, you get 38.5. So, average years someone's living. So that's how you kind of get some of these numbers. So yes, we're living longer a little bit in a sense, but we're having much more exposure on the way to nutritional deficiencies, toxicity, and certainly with Alzheimer's, I think Parkinson's, as time goes on, we're going to find a lot more things that are toxic in our environment, probably some things from our food, things we're exposed to on a regular basis that are increasing our risk of getting these brain conditions. It can be life-ending for many of us in the end, a long life-ending process. So in this case, in this study, the vitamin D playing a role. And they wanted to find out what kind of levels that people actually have and compare to those who not. So here's some of the bigs that they found out. So one is they found out that vitamin D levels were lower in people with Alzheimer's compared to those in the control groups out of almost all the studies. And when they added the studies together, they noticed that the vitamin D levels were also lower in people who had Parkinson's compared to those who did not have Parkinson's. And the question is, well, how would vitamin D really play a factor in affecting these things at all? And one is, vitamin D is actually a hormone versus a vitamin. It has many effects in the body. It can be anti-inflammatory as well. What we're not saying is that having low vitamin D is going to make you get Alzheimer's or make you get Parkinson's. But what we are saying is that, hey, listen, these nutrients are deficient. These patients are deficient in vitamin D, so therefore it makes a lot more sense that if anybody's having some early signs of Parkinson's or early signs of Alzheimer's, they should be screened to check for the levels of vitamin D in their blood. And there's tests for that, very easy tests to be done that can test that. Standard tests in any medical office could be done, as long as you have a lab available to do that. So you want to start looking at different factors along the way, and certainly vitamin D is not the only one to consider in somebody who may have Parkinson's or Alzheimer's or early signs of that, but it's looking at all the factors of their health, even their teeth for that matter. What if they they've had a bunch of root canals and they're not really feeling any problems, but root canal can be a problem for the immune system over a long time, and that can contribute to increasing the risk of some type of a brain disease long term if your body's so focused on dealing with this part of your body because you've got dental problems versus taking care of the rest of your body. I know I make it sound kind of simple, but I'm trying to kind of make it kind of a simple explanation of how to use this. But definitely with vitamin D, we are coming into a time now here in Alaska where we're actually going to get some vitamin D from the sun. Probably not about right now as time begins, mostly in the Anchorage area for sure. And that'll pretty much be slacking off about the 1st of September. So, definitely don't go out in the sun and get burnt. And I hope we have a summer where we actually have that being a concern because we haven't had many like that in some time. But getting your vitamin D from the sun is very important. And I've taken, vitamin D in a supplement form at least 9 months of the year, if not daily, would be some great advice. and you need to consider looking at where you're starting from. Again, it's important to have a vitamin D blood test done. And it's fairly inexpensive. Some labs charge a fair amount, some don't. So you got to find the right ones. But good article, and that came out of the Journal of Nutrition, but came from the website of vitamindcouncil.com. That's vitamindcouncil.com. Check it out. That site was created and is run by Dr. John Cannell. It's great work he's been doing for us. Welcome to today. This is Dr. Michael Ellenburg. It's our radio show here on Fox News Talk, 1020 AM, 95.5 FM. You also find us online at foxnewskoan.com. You can live stream us. If you have questions about your health today, our number here is 522-1020. That's 522-1020. Okay, speaking of all the ones I was talking about on the brain, let's see here. This is a good one. This one is looking at, it came from the Diabetes Journal, and they have, each month they have just a whole wealth of variety of studies looking at diabetes specifically. And in this particular study, they were looking at how glucose is used in our bodies, how we're actually putting out insulin to take care of storing glucose, and looking at the risk for developing depression in the middle age, as far as middle ages, as far as our groups. And a very interesting study. What they found out basically is that over a 5-year follow-up, people who had new onset, that means new occurrences of depressive symptoms, the numbers were, out of the totals, like out of 3,400 people, in men it was 142, women it was 84. And women in the lowest level of insulin secretion actually had almost twice the level of developing depression versus those with higher insulin. Now, these levels weren't being measured in diabetics specifically. They're just picking this population to see if the insulin resistance or metabolic syndrome increased the risk of someone developing diabetes. And it may not. But low insulin, which you don't see very often, but you can see it, low insulin secretion may actually be a problem for those developing new onset of depression symptoms. And you can measure your insulin output via fasting insulin. You can also measure one called a C-peptide, or C-PEPTIDE, C-peptide. You can also see what's the amount of insulin your body's actually making. And this is kind of an important factor, because this case is talking about having almost like hypoglycemia, low blood sugar, being a risk factor for depression. That's kind of what the study is basically saying. So, interesting. Never seen a study like that before concerning that direction. Usually we're always about if it's too high, what kind of problems is it causing? Not if it's too low. So, all right, we've got about 10 minutes left in today's show. If you have questions or concerns in medicine or whatever you have going on as far as medical-wise, give us a call here if you like, 522-1020, 522-1020. An interesting study appeared here recently, I think it was last week, again in the Journal of Diabetes Care, looking at higher mercury levels in humans and a possible association with an increased risk for developing diabetes. And what they found is that this new study is that higher levels of mercury exposure in young adults increase their risk for type 2 diabetes later in life by 65%. Now that's a big number. Now, as the study points out, it is a complicated picture because mercury in humans can come from a variety of things. It can come from the fish. Shellfish can come from as well. It comes from dental fillings in your mouth if you have old dental amalgams. You can also be exposed to mercury from the air. Methyl mercury is the most common pollutant out there concerning mercury that's around, and we get a lot of different coal-fired burning plants in places like over in China and Mongolia. Alaska is in the airstream. We can receive some of those things. You never know it. But another way of being exposed to mercury. And even mercury was involved in paints until like 1995. So there's exposures from paints as well, from mercury. Many of us in places who were at least 20 years old, if not older sometimes. But in looking at food, what are some of the big areas? And the main food areas for exposure to mercury are going to be in fish and shellfish. And we could also argue that, and I haven't seen this information come up because it pretty much freaks out anybody in the corn industry, and that is high fructose corn syrup, of course, is made from refined corn. And high fructose, the process of making that, they use a substance called chloralkali. And about half of the chloralkali in the U.S. is manufactured with the use of mercury. So here you have the chloralkali that ends up being used with making it involves using some mercury. Then they're going to get this process involved in making high fructose corn syrup, and it's within that syrup itself. So it's an interesting, and it's difficult. And I've yet to have seen someone do a study where, hey, let's go out and measure high fructose corn syrup for levels of mercury and see where they're at. I haven't seen that study yet. Nice to see that study. But in this study, specifically again looking at fish and shellfish intake and their exposures to mercury. And this study was published online in the journals of diabetic care. And that people with the highest levels of mercury, here's the kind of conundrum, also appeared to have healthier lifestyles. They also had lower body mass indexes. They also had smaller waist circumferences. And they had more exercise than anybody else involved in the studies, even though they had the highest levels of mercury. And so the question comes down to, why is that? Well, one possibility here they suggest is that people who were on the, say, a little better well off financially were able to be eating things that typically can be markers for a healthy diet, like fish, of course, being one of those. Well, the problem is that can contain and do contain mercury, depending on the type and where they're at. And this study looked at over 4,000 men and women and established really an interesting link between mercury levels and type 2 diabetes after they took care of lifestyle factors and other things, such as magnesium and omega-3, to kind of ferret that out of the data to make sure that wasn't confounding or causing confusion in what the answers were. And the findings point to a big importance of what kind of fish we should be selecting, that are known to be low in mercury, such as salmon, shrimp, others. But really bad ones concerning things like swordfish and shark can also bioaccumulate over a long period of time. They're very predatory, and even tuna, for that matter, a fair amount of mercury in our bodies, and then we consume these things and they get us into us. So. There's a great book out there called Mercury, Diagnosis Mercury, and from Dr. I think it's Jill or Jane Hightower, I forget. She wrote this book here about 5 years ago or so. Great book, and a primary care provider out on the West Coast, but noticing certain interesting factors about our patients, and started really looking at the data and what are sort of their symptoms, and they were all kind of general, but she kind of come across the thought of, well, what if there's something to do with the food they're eating? And through her research and even with her own patients and doing certain types of testing, she realized or could find in certain patients that if they had a high level of mercury going on in their blood, for example, or urine at that time, that meant they had been consuming something very recently in the last few months that might be high in mercury. And it turned out for a lot of people, actually, it was sushi was one of the biggest ones in this study that she found. Those eating a fair amount of sushi had quite high mercury levels inside their bodies in general. So again, they're very involved in our food. But what we're trying to look at here is decreasing our risk, in this case, in this article, of diabetes. And we don't know exactly how the mercury causes a problem and can increase someone's chance of developing type 2 diabetes, but it's some type of effect, obviously, on how insulin and glucose are involved in the body, or some pathway we have yet to discover. But it's a good reason to watch your intake of fish, certain kinds, and what are high in mercury and what are not. And again, the ones that are low in it, we'll say salmon for the most part, shrimp, certainly not halibut, so a rainbow trout or Arctic grayling for that matter. Higher levels were found in swordfish and shark and salmon, and some salmon and catfish. So reasons to consider eating less at times. And unfortunately here in the state, I know we're still measuring for mercury levels in fish, which is good. We should also be measuring radioactivity levels in fish as well, because Fukushima is still a real thing out there, folks, and it's a real thing taking place. They're having a hard time over there in that realm of Japan right now, housing these big tanks of radioactive waste and causing lots of problems, and probably seeing some of that dumped into the ocean again. So, good important reason to be wary of what you're actually eating. Okay, well, folks, we've got about 5 minutes left in today's show. If you got questions about your health, now's a great time to call. The number here is 522-1020. It's 522-1020. We wait for a call around the day out here at the end of our show today on talking about a very popular category I like to talk about, and I haven't talked about in a while, and that is genetically modified foods, or GM foods. These are foods where you have seeds that have basically been changed through scientific intervention to make them do certain things. For example, you have what's called GM corn versus non-GM corn. And so GM corn, through our great friends at Monsanto, decide, hey, listen, if we can manipulate the genetics of the corn so that when we spray our on it, that the corn can break it down, wouldn't that be a great thing for us? Hey, well, it'll keep less, hopefully, pesticides, less of that Roundup inside the actual product. and we'll have better yields. That's kind of the argument on either side about what they're trying to pull off. Well, what happened is, and I forget, it must have been, didn't say what state, it may have happened in Canada, but basically a group of farmers, this article first appeared on Moms Across America's March website. And here it goes, this is Midwest. So Midwest fields in the U.S., and they compared GM corn versus non-grown GM corn from adjacent fields. And so some of the background here, the GM corn was grown in a field that had no tillage, so it wasn't being turned up to increase the nutrient density of the soil. It had been continuously used as GM corn for over 5-10 years with basically Roundup is this herbicide and weed control. All right. The non-GM corn it was compared to did not use Roundup and had not been applied to the field for at least 5 years, as far as how it went out. And what they looked at is that one of the researchers posted the results and commented on them. And so glyphosate, which is this pesticide, Roundup, is shown to be toxic at about 1 parts per million. That's a measurement, and it's hard to understand some stuff, but this is the data here. In the GM corn, that toxic pesticide was found at 13 parts per million in the GM corn. They also found an increased amounts of formaldehyde at over 200 parts per million, which is 200 times the level known to be toxic in animals. So here's this GM corn, high in the glyphosate fertilizer, high in formaldehyde. They also found that the GM corn was very depleted in essential minerals, such as calcium, magnesium, manganese, phosphate, and sulfur, and many other ones as well. Now, what's so wrong with the glyphosate, in this case the Roundup that's within this stuff? Well, the problem is that it accumulates over a longer period of time inside our bodies, and we've got a fair amount of data that have demonstrated that exposure to this type of pesticide increases miscarriages, birth defects, can increase risk of cancer, can disrupt your hormonal system, can cause toxicity to your nerves, even problems to your liver and your kidneys. So it's a big deal. The other thing, folks, the other compound found in the GM corn was formaldehyde. Well, when I was in naturopathic medical school, we worked on cadavers that had been soaked in formaldehyde, and it's not a very nice smell. So it preserves things, okay? And it can be very toxic to your nerves and your genes. And this high concentration was not an expected finding. And they're trying to kind of figure out, well, why is that? And so the thought is that the process of how the Roundup is actually broken down in the soil and within the plant is causing this increase in formaldehyde. In a sense, kind of naturally. I mean, they're not putting formaldehyde into the soil, but as a result of using this Roundup, they're increasing the occurrence of formaldehyde within these plants. So one thing you should look at sometime you get a chance is just Google around and find out how many foods are made from corn. It's a lot. And this really goes back and echoes a great point, and that is that we really need to have GM labeling laws in this country. Really important for our long-term health. Europe's been doing it for a while. Smart thing to be doing. Folks, it's a sign that our time is going to end today. I do appreciate you listening, and thanks for the call there, Tom. During the week, you'll find me at the Ellenburg Center for Natural Medicine. Our phone number there is 563-2366, and I'm here on 1080 and 95.5 FM KON on Mondays from 2 to 3 p.m. Have a great week, and we'll talk to you next Monday.
Over there. All new directions must go everywhere. Big round people in a cool little square. Or you can cut it with a boat or a plane. Man, it's gonna take a new train. You'll be leaving on a new train, far away from this world of pain. And when you look out your window, you'll see your home, your baby, and your family. No melted ice.